So, Dr. David, after this wonderful information that you gave us, what is your last recipe of success you can tell the primary care physician to implement it tomorrow onwards during their clinical practice?
Take-home message, something they could do different tomorrow in their clinical practice. First, I'd invite them to all take a pen or a pencil or press pause and get a piece of paper. The first I would suggest, because it was the main subject of today, is please consider in a patient who you consider to be at risk of MASLD and MASH, please consider the very straightforward testing of a FIB4, AST, ALT, platelets, age, a calculator, above 1.3, send them for a FibroScan, and please understand that this is one of the silent and treatable conditions of excess adiposity. The other take-home messages are threefold. I suggest that when you sit across from someone with MASH and MASLD, or knee osteoarthritis, or ASCVD, or sleep apnea, all these what we call the leaves of the tree of obesity, please consider leaning in and telling your patient three things. And this constitutes behavioral therapy in obesity management. Number one, please invite your patients to consider if they struggle with excess weight. They are struggling with a real medical condition that is brain-centered, genetically conferred, progressive, environmentally influenced, and not their fault. Not a flawed character, not a lack of willpower, not them being not disciplined enough, but instead them living with a real disease, untreated. And mention, please, that three pillars of treatment exist: behavioral therapy, medical therapy, and surgical therapy. And if they're interested, you as their primary care doctor would be very happy to be their partner in their journey of managing their weight.
Absolutely.
The second message to them regarding obesity is that obesity has a main symptom. When we treat obesity, we are treating appetite dysregulation, the motivation to calories that is very natural to drive us to do the work to acquire calories, and this has collided with our modern food environment. And so help them understand their high-risk times of over-consuming calories. This is the ultimate and central symptom of obesity and the target of medication. Medications like semaglutide or tirzepatide manage to dampen the appetite dysregulation. And that brings me to my third point. And I share it always as a bad news piece. Your brain will defend against fat loss with increased appetite. It'll push back. It has bookmarked your highest weight. And that's why the role of medication is long-term, because the medication will defend you against your brain pushing back up. Please communicate these things respectfully to your patient living with obesity and complications of obesity like MASH, and become a partner with them in addressing this very treatable condition, which is the main risk factor of death and disability in your clinical practice, and yet is treatable and manageable with the excellent treatments that we have now available. That would be my message to them.
Thank you so much. Well said. And in fact, obesity is recognized to be a disease, which is a chronic, reversible, and even treatable.
Yes.
So I think it's a good opportunity to call for action for the primary care physician to consider obesity as a major component of their clinical skills that they have to upgrade, and to look into the different complications that obesity might have. And we talk extensively about the MASH and the role of semaglutide in treating it. So we have a very rewarding molecules that can prevent and delay the complication of obesity, or even treat the complication of obesity in terms of MASH.
Yes, these are very exciting times.
Yeah. Okay, on behalf of all the audience and the colleagues that we have witnessed our podcast today, I would like to thank you, Dr. David, for your wonderful contributions and for your insights and expertise and the knowledge that we have disseminated today. And I think it's a very clear message that primary care physician, as a gatekeeper of the healthcare system and the first contact with patients, they play a pivotal role in the management of obesity and prevent the complication by treating the complication early stage, identifying those patients at risk of getting into this complication, treat appropriately using using the semaglutide and refer the patient to the subspecialty and bring back the patient again to maintain the continuity of care along the spectrum of our primary care. So we would like to thank you very much for your contribution and looking forward to see you back again here in Jeddah,
I would love
Dr.
to come
David.
back. Yes, thank you for the invitation and looking forward to coming back. And thank you for the very interesting conversation.
Thank you so much. Have a good day.